let me check the chat real quick to make sure I'm not missing anything. Danielle, yes. Dania, was wondering if I'm able to take the quiz. Danya, stay on after class. Okay. All right. So I think we're ready to roll. So hi, everybody. Welcome to week 9. Week 9. We're in the home stretch. Hi, Tamu. We're in the home stretch. I sent you guys your announcement this weekend was a roadmap, right? Was that helpful? To go through.
Yes, it was.
So I went through the rest of the term. Okay, so let's see. This week, HESI prep, case study, and NCLEX, right? And an
Yes.
exam review if you can get to one. I already had mine this morning. I only had 2 people, but I just sent you all the recording. Okay. So you get 4 things. Next week, vulnerable populations assignment, exam. Week 11, HESI and an NCLEX assignment and your remediation. So in this week's announcement, I sent you remediation guidelines, so you know what to expect. I know you've seen them before. It's no different from the last terms. About the hours you have to spend. Let's say you score a 900, you have to spend whatever, an hour. Okay. I sent you that, and then I sent you our week 9 concepts that we're going to cover today. And then I think it was yesterday or the day before, I sent you the hang on, still letting people in. I sent you the study guide for exam 3. Did I not? Everybody has that? Okay. So if everybody could turn their cameras on, second request, please turn your cameras on. So for right now, I think you have everything you need. Do you not? A lot of lay people today. So you have everything you need, right? I've already graded, I think I've graded every HESI, well, at least as of last night, I've graded every HESI prep that's already come in. Yes, Pamela, you're in the right. Yes, yes. I've graded everything so far. I do have a few vulnerable populations assignments that have been submitted. I haven't got to those yet. Those are for next week. But I have started grading HESI prep assignments, and you did a great job for those that have turned it in. I mean, again, this is your study guide. I have some when I do my HESI review, we'll go through that, and then I have some more topics that I want to mention that I believe will be on HESI. But when we do our exam 3 reviews and our HESI reviews, remember next week I forgot to add, you have your I'd rather you, Pam, stay on after class. We'll talk about it. You have exam 3 reviews this week and HESI preps next week, right? Okay, so we get a lot going on. So today, here's what we're going to do today. We're going to spend the first part of class just reviewing the concepts from today. Cultural culture and human abuse and violence. Okay. And then we're going to spend some time going through the exam 3 study guide. Okay. But that's not going to be in a replacement for trying to get to an exam review. But I know a lot of people can't get to them. So I want to make sure I spend some time on that review guide. Okay. So in the meantime, if you could all pull up your notes from today and pull up your study guide. Okay. We don't have any quizzes today. We're done with quizzes. So anybody have any questions before we get started? Y'all feeling pretty good about the class for the most part? Okay. Okay, let me share my screen. And we'll start with notes. Let's see, why are my notes on my other screen? Okay, we'll have to figure out how to drag those over. Good. Oh, maybe because I'm on Zoom. I got another monitor and I haven't figured out how to really work it yet. So if I'm looking to the side, oh, but you can't see my notes. All right, let me try and turn this off then. See if I can. Isn't that lovely? Let's see, week 9. Okay, well, here I am thinking I'm all fancy having an additional screen. And now I can't pull my notes up even though I shut the other screen off. So hang tight. Let me. Oh, you're such a. Let me try that. All right, let's see if I can pull these up now. I can't pull them up. One sec. Just bear with me. I'm not going to flip out yet. All right, I'm going to read off my other screen since they're there, but you guys have them in front of you, but you can't see my screen. So follow along with the notes. How's that? Okay. Make sense? Everybody pull up your notes. Okay. Human abuse and violence. Lot to talk about with human abuse and violence. Lots of different kinds of abuse and lots of different kinds of violence. Can you start naming some kinds of abuse and violence? We have family violence, domestic violence. What else?
Abuse for children.
Child abuse,
What about financial abuse?
financial abuse,
Emotional.
emotional abuse, psychosocial abuse, what about human trafficking? Okay. What about violence? Violence, we have murder, we have assault, suicide, battery, we have family violence. Okay. So violence, I'm looking at our notes here, violence is common in vulnerable populations. Okay, why do we think that is? Why
because
is that?
they're less likely to be able to defend themselves or advocate for themselves and report it.
Mhm, mhm. Substance abuse. Okay, it's common for vulnerable populations, just as substance abuse. Hang on, substance abuse is a form of exhibiting control and power, right? People who become, I'm reading from my notes here, people who become involved in violence typically have had previous exposure to some sort of violence. Would you agree with that?
Yeah.
Abusers have often been beaten when they were children.
Some people mimic what they see.
Exactly. Exactly. They were often beaten when they were children, or they witnessed siblings or one of their parents being beaten. They learn that violence is a way to manage conflict, right? We know that high levels of violence are tied to health disparities and adverse health outcomes. Remember, think of all the people that have, well, everybody, think of all the people, how they cope with stress. A lot of people have a lot of stuff going on. How do they cope with it? Some may cope with it in a healthy way, others may not. Right? We know that chronic stress causes physiological symptoms or even conditions, hypertension, diabetes, cancer, hormonal disruption, right? Nurses, we know what is mandatory reporting? What is that? We should all be aware of that.
When you have a patient that came in and is probably complaining that she's being abused, or she's not audible about it, but you see like marks all over her body, and they request you not to report, you're supposed to tell them that you're a mandatory reporter, and
Mhm.
it's mandatory that you have to report that.
Absolutely. Kids, elderly, right? I was in the schools for 22 years, lots of reports I had to make. Okay, it doesn't matter where you are. If you're at work or if you're at home or if you're at the neighbor's house, if you're at the grocery store, if you suspect abuse or neglect, you need to report it. It's tough. It's tough to do, but we are considered mandatory reporters. Okay. Nurses are mandatory reporters of violence against children and elderly and vulnerable adults. However, we do not report violence against adults without their permission, right? As they must have an escape plan before the police are notified. Okay? There is a difference between, I want you to know the difference between physical neglect and emotional neglect. Okay, this is in your notes. Physical neglect refers to the failure to provide adequate basic needs, food, clothing, shelter, hygiene, okay, or necessary medical care. That's physical. Sorry, I'm just still letting people in. Uh, Emotional. What's emotional neglect? Omission of basic nurturing. Okay, acceptance and caring essential for health development. Do you understand the difference? Physical and emotional. Meeting the basic needs, versus participating in the nurturing and the development and the raising of the kids. Okay? We know that kids who are exposed to violence, or they're victims of violence, or witnesses of violence, they become higher risk for mental disorders. They also become high risk for self-harm, high risk for substance abuse, high risk for violence, perpetrating violence themselves. Right? Abuse is about power and control. And all of these methods are about control. Okay, what do you do? What do you do when you have a client come into your clinic or ER that has a spouse with them, and the spouse is accused of abusing, but yet they won't let the victim talk? They won't let anybody in the room. What would you be thinking?
That they're keeping them isolated, that they're trying to isolate them so they can't report the abuse.
Mhm.
I would think if the spouse is not speaking, did you say that?
Mhm. Or if they are,
It's
if
probably
they're the one doing all the talking.
it's probably been trained
Mm-hmm.
to say, you know,
You know, no
because
matter where you work, you're going to see patients. You're going to see clients that are either perpetrators of abuse, victims of abuse, or witnessing abuse. It's going to be present in your practice. So it's really important to understand, and in your readings, it goes more in depth of how to identify child abuse, how to identify spousal abuse, how to identify family violence, how to identify elderly abuse. So please do your readings for this week. Don't just rely on the notes. Okay. Generally, family violence is violence between the most powerful and the least powerful, right? Family violence is perpetuated in a cycle as children grow up seeing the violence and they use it as a method of control over the kids, right? Abused children are more likely to perpetuate violence or tolerate violence in their own relationships as adults. That's important. You know, I saw this a lot in the schools with the high school kids and the relationships they were developing. You know, if they came from an abusive household, then there were relationship issues in high school of them having partners that were abusive themselves. Very, very common in high school. Does that make sense?
Yeah, we was just talking about this yesterday in the psychiatry class that I have online.
Okay.
We was talking about bullying, cyberbullying and bullying within the schools. And they were saying a lot of times that it comes from a home, like if they come from a home where like the dad is abusive to the mother, then they would go to school and bully the other kids at the
Yeah. Absolutely. Yeah. Right. So often abused kids are more likely to perpetuate violence and tolerate violence in their relationships. Maybe think of all the families living in poverty, living under very stressful conditions. Okay, they may be dealing with a crisis. Joanne, it's in your announcements. Check your announcements. Maybe there's an unplanned pregnancy. Maybe there's a medical diagnosis. Okay, Joanne, stay on after class. Should be in your announcements. Did everybody get the study guide? People get the study guide? Anybody not get the study guide?
Yeah, it's in announcements.
Yeah, it's an announcement.
Joanne's looking
Yeah, I
for
got
it.
it too.
I got it.
Does Joanne have it now? Okay.
It says week 8 on it.
Okay. Maybe somebody can send it to Joanne. Look what happened during COVID. Look at the isolation, social isolation, school closures. What are the post effects we're seeing now? Mental health crises for kids, all ages. What else are we seeing?
A lot of stress and anxiety and depression.
Suicide. Yep, Jacob, go
More-
ahead. Go ahead.
More children being susceptible of dropping out of school or turning to drugs and alcohol.
Absolutely. I need everybody.
And also to the
Okay.
communication skills, I'm sorry,
Okay.
it's getting like, yeah, the skills to communicate because everybody had the mask on and stuff and whatever.
Yeah. Yeah. Lots of
People not
development.
communicating.
Yeah. Lots of developmental issues with the younger kids, with speech and language. Right. So we know that social isolation does contribute to the violence. And when you have a reduced social support system, when a family's going through a crisis, what's going to happen? It's only going to get worse, right? Elder abuse is also a type of family violence. Okay. And elderly always have to be assessed for the potential of neglect or abuse or violence going on. Okay. Abuse is for the elderly too, is about control and power. Could everybody turn their cameras on, please? I can see the big screen now. I'm not sharing my screen. I can see the big screen. So there's people that aren't on camera. So I need you to get on camera, or else you're going to have to step away from class. It's kind of the way it is. What do we think the kids are going to exhibit? Victims of violence exhibit symptoms in kids. This is how we picked up on a lot of stuff going on in the schools. Kids coming into the clinics, complaining of headaches, complaining of stomach aches. Parents telling us the kids are bedwetting. Seeing kids at anxiety, depression, withdrawal behaviors, inappropriate sexual behavior, inappropriate sexual knowledge, precocious teens, menstrual disorders. We were able to identify lots of potential violence, working with the high school kids. Violence is frequent, it's common in high school, college kids. And we have to be aware of that. The part dating, when they first start dating, right? With regards to domestic violence, I want you to know a fact here. The top risk factor for intimate partner violence, has everybody heard that term? Intimate partner violence is previous reporting of domestic violence. Okay, so intimate partner, IPH, intimate partner homicides. The top risk factor is they've had a previous domestic abuse report. Other risk factors for intimate partner homicide: access to guns, estrangement, threatening to kill or somebody or threatening them with any kind of weapon, strangulation. As far as women, abused women, some of the signs and symptoms: prone to headaches, chronic headaches, palpitations, sleep and appetite disturbances, sexual dysfunction, irritable bowel syndrome, frequency, urinary frequency, urgency, recurrent vaginal infections. Okay, these are all in your notes. Abused women also are higher at risk for experiencing more miscarriages, preterm births, low term, low weight, low birth weight. And the other commonality is during pregnancy, abuse generally tends to escalate. Okay. So when you suspect any kind of abuse in an adult, try and ask the best way you can in a non-judgmental way to give him or her the opportunity to report without feeling shame. That's really important. Okay. Let's talk about the elderly in particular, at risk for any kind of violence, physical, emotional, financial, as well as neglect. Right? Here's some examples. Emotional abuse includes behaviors to demean or affect the elder's self-esteem. Maybe name calling, just trying to scare them, embarrassing them, destroying their property, or not letting the person isolate them from their family or friends. Neglect also occurs with the elderly when basic needs are not being met: food, housing, clothing, medical care, maybe abandonment. Okay. We've all heard the horror stories about financial abuse with the elderly, right? Maybe family members taking over the financials or them getting scammed, right? Suicide. Suicide is a form of violence against yourself, obviously. Second leading cause of death in young adults, ages 10 to 34. Leading risk factors for suicide: depression, mental health disorders, substance abuse issues. Other risk factors: maybe a prior suicide attempt, family history of suicide, mental disorder, firearms in the home, incarceration, exposure to suicidal behaviors. And think about it. Children who threaten to harm others or maybe are abusing their animals are probably more likely to hurt themselves and hurt others. Yeah. Guys heard stories about that with the kids. So as far as school, and we talk about school, primary prevention, okay, primary prevention with violence in the school setting. What are some primary prevention activities we can do in the schools?
Teach your parents coping skills.
Perfect. Great one. What else can we do?
I think we need to do
Anger
anger
management.
management. Yeah, for some kids.
Mm-hmm. How about teach kids effective coping strategies?
Mm-hmm. Mm-hmm.
I mean, we're seeing every kind of violence everywhere in every setting now, are we not? The home, the school, the workplace, the grocery store, out in the
Maybe
streets.
maybe give the parents some social support, like giving them, like letting them get involved in the community more, like more with the school, like where how they do field days and everything.
Yep.
Feel like that might help a little bit.
And what about classes for parents on parenting? Classes on, how to manage, how to balance life and kids. I think that,
Respite.
pardon me?
I was saying respite care, like,
Yeah.
if the parent get all tired and burnt out or whatever and stuff, just take breaks or whatever.
Yeah. Respite care. Sure. Sure. Yeah. It's violence. It seems that, every time you turn on the news or read the paper or whatever, it's just violence everywhere. Everywhere. Okay. And you will experience, not you yourself, but you'll be caring for clients, or maybe even you have already experienced what we're talking about. But you will see it in your clinical practice. Like I said, whether they're perpetrators, whether they're victims, whether they're witnesses. Okay. Sia, are you around? Because your camera's been off the whole time. Okay. All right, let's talk about, anybody have any questions about violence and abuse and neglect? It's a tough subject. Has anybody had an experience like in your workplace, let's say with the elderly or working with kids, that you've had to report?
I don't really work in the medical field as of right now. I'm in the process of getting there, but one of my coworkers from one of my previous stores that I worked at, I work at Wawa right now, and her husband was very, very controlling of her. Like he would always like at least like between 3 to 4 times during one of her shifts, either he would call her and she would have to answer no matter what she was doing in that moment, or he would show up at her job to make sure that she was there. And like he would, if she didn't answer the phone, like you could hear him screaming at her basically. Like it was it was pretty rough. And eventually we had to kind of either have a conversation with the manager, and you really couldn't do anything like exactly because for one, I mean, she wasn't the elder, it wasn't the elderly, like she was very stuck, and she just felt like it was one of those situations where it was her fault, and
Yeah,
she was very in denial of the situation, but it was
sure.
something that we did experience.
I would gather that all of us either know or work or live with somebody that's either experienced violence, maybe even been a perpetrator of violence, a victim, or has witnessed violence. I have. I know I have. I mean, right? We've all been exposed to it in some way. Let's talk about cultural influences in nursing. Okay. We've talked about culture the whole term. Okay. You've had a little bit of culture question. You've had culture questions on every exam. And there'll be culture questions on this exam. Okay. This particular topic is cultural influences. Okay. So what is culture? It's everything we believe to be true about the world, right? All of our cultures, whatever culture we're part of, we have a set of values, we have a set of beliefs, we have a set of practices, assumptions about life. Okay. Some ethnic groups may have cultural similarities. However, we are all unique, right? We're all unique because we all grew up differently, but we all belong to some kind of culture. When we think about culture, think of all the things that are different: language, beliefs, maybe healthcare, foods we eat, food preparation, personal space, body language, eye contact, perceptions of health and illness, family structure, right? Family structure makes up our culture as well. Childbearing practices, the presence of whatever your orientation is to time, whether you're future oriented, present oriented, past oriented. Right? So all these cultures have all these different aspects to them. Right? So as nurses, we have to approach each culture and each individual as if they were a unique individual. I can't stress that enough. I think that was an exam question. It was like a select all that applied. We have to make sure that we approach each client as individual. And we're trying to incorporate their culture, their cultural beliefs, values, practices into whatever healthcare plan they need. Right? What can we safely incorporate? What parts, their beliefs, their practices of their culture can we safely incorporate into their plan of health as we're trying to plan for them to go home? Right? Again, we've talked about this before. You have to check your own biases and stereotypes and feelings about certain cultures if you have them. It's going to be hard to take care of a specific culture if you don't believe in that culture's practices, you disagree with their practices, their beliefs, right? But as nurses, we're expected to be culturally competent and take care of many different cultures. Okay. What happened? So in community nursing, one of the things that is important is partnerships, collaboration, partnerships, reaching out. I gave you that scenario in like week 1 or week 2. You're walking into a new community, you don't know anything about it, you're the community nurse. And you need to do an assessment of the community. Okay, where do you start? Well, for purposes of this class and community partnerships, where you start with is seeking out the leaders in the community. They're going to help you and assist you in doing your assessment. That may be a religious leader, maybe education leader to get the education information you need, a religious leader to maybe talk about the cultures, the different cultures in the community. Maybe you reach out to law enforcement to talk about crime in the community, right? Because as the community nurse, you're trying to put together a plan with all the stakeholders to come up with a plan for obviously improving the health and the safety and the functioning of the community, right? So community nursing certainly involves a partnership. Whereas you take care of a patient in the hospital, you're their nurse. You're expected to know all about them, right? You get a report, you know about them, you go care for them. In the community, you're just not going to have all that knowledge. You have to rely on partners. You have to be collaborating and talking with others. So trusted community leaders can help the nurse as she enters into the community. Okay, they can help with a plan. This is on your notes. They can help with a plan that's best suited to meet whatever the needs are. There's a lot of people in the community that have been there that probably have already done the assessment, right? And know what issues are going on, know what needs to be worked on, know what health issues there are, know what safety issues there are, know what education issues there are, whether it's high dropout rate, high crime rate, right? And again, I've mentioned this before, but maintaining an open and objective attitude towards individuals and their cultures, right? Avoid seeing all individuals as alike. Be aware of your own cultural beliefs. Avoid projecting those beliefs, your beliefs, onto others. And we've talked about culture, but I want to be specific here. What is cultural awareness? Cultural awareness means we have to do the self-examination and exploration of our own beliefs. Our beliefs, our biases, our prejudices, right? So nurses who lack this cultural knowledge, cultural awareness, cultural competency, you're gonna be doing an inadequate job if you can't get through those barriers of yourself. And then the last paragraph, I just want to read to you in your notes. It's really kind of this is the final piece to our whole class, right? So to develop cultural competence, be sensitive to all cultural implications during every encounter, avoid stereotyping based on race and ethnicity, ask questions to stimulate your learning about different cultures, right? About their world. Avoid making assumptions about nonverbal cues from clients from unfamiliar cultures. For example, I'll just jump in the example of the Native American culture. Doesn't like eye contact. They look at the ground. That's not a reflection on you. That's part of their culture. Okay. We're continuously, and I, after 40 years of nursing,
Look at if it's working
somebody-
and if it's
somebody want to
confusing.
mute?
What are we going to check?
Guess I'm gonna have to, somebody,
Check the site. How often are we going to check the site?
hang on. Let me see. Somebody,
Every 6 hours. I like that answer. And when we check the site, we are
Kariba, can you
So
mute?
Reba, you
I'm
need to go
trying to
on mute.
find who it is. Okay, thanks. We're always making ongoing discoveries and learning about different cultures, right? That's how we improve in our nursing practice. We include patients and their families, right, to learn, right? We can't believe that our culture is superior to others, whatever your culture is, right? And to use interpreters. Use translators. A lot of cultures are not going to speak the English language. And that's another thing your community can help with. Okay? So being a community nurse is also being culturally sensitive. You know, you're going to be caring for lots of different cultures in the community. Some speak the language, some don't. If they don't, and you can't speak it, you got to find some help, because you've got to be able to communicate with the cultural diverse populations in their own language, providing them written material in their own language, being able to talk to them in their own language. Okay. Questions about cultural competence. I told you in week 1 that we'd be talking a lot about cultural competence. I'm really big on that, only because I've seen over 40 years the how life is developed and how diverse our culture is becoming year after year. And I've seen nurses struggle with trying to incorporate that cultural competence into their practice. And it's if you can't, it's just a no-win situation. You have to. It's part of our practice now. Anybody have any thoughts on that? Anybody work with different cultures in their workplace, or have different cultures in schools? I mean, that's where I learned a lot of, became very culturally aware in the schools. We had little pockets in all the communities of different cultures. I learned a lot about international cultures, and it was great. Anybody work with different cultures now that they're learning about? Or have a clientele that's a specific culture that you're learning about? What are you doing?
Yes, in clinicals actually, med surg too. We have I think it's a Muslim, and I think the people from the nutrition department came to ask them what they would like to have for dinner. I mean,
Mhm.
for lunch, and they mentioned pork, and they were just totally disgusted about it. And they were
Mhm.
like, please, no pork. And then that's when I remembered that they don't eat pork, the Muslims.
Right.
Yeah.
Ain't that deep.
Pardon me? Who else? Give me some examples of your cultural competence. Nobody works with different cultures other than Lorna?
I mean, I have my area and everything where it's a very diverse population. I live in like Port St. Lucie, so there's more like prone with um different kinds of different cultures. Where I work and everything, we have there's we ha I have a there's Hispanics, there's Caucasians, there's African Americans and everything, and it's very cultural based. I
Mhm.
there was one of my old coworkers and everything. We had like a barbecue day or whatever, and she brought in some Haitian food, and it was one of the best food I've ever had. It's
Sure.
just different. You know what I mean?
Yeah,
It's just
yeah,
very different. It's
yeah,
honestly, it's probably amazing. It's really
yeah,
amazing, honestly.
yeah. Thanks, Jacob.
So
Who else?
one example of that can be like, you know, those women from the Middle East, like, can I say like this is probably real more religious than cultural, but it can be cultural too. They don't want men to care for them,
Mhm.
male nurses, or see
Right?
them naked or uncovered or anything like that.
Absolutely. Right? Absolutely. That's one of their cultural beliefs and cultural practices that has to be accommodated. Yeah. Anybody else have any other examples?
I mean, I have relatives that are Seminole Indians, and
Mm.
so even with them, it's like there's no, they do their certain powwows. They go to do their medicine man. They
Mhm.
are not able to cut their hair.
Mhm.
They're even the men. They babies are shaved. It's just their funeral when they're in when it's at the funeral home, they have to be in a certain position. The casket has to be facing a certain way.
Mhm. Yeah.
I think me also, like, I think it's still on the Muslims. I think this was some time back. It was time for medication, and the patient was like praying because they have like specific times where they pray, and the nurse just like held the medication until she's done. And I thought that was quite respectful.
Mhm. These are all examples of cultural competence. Yeah. Okay. Let's pull up your study guide. Right, pull up their study guide. And since I can't pull it up on my screen, I have it on my other screen. We're going to read through it. So if you want to follow along, pull up your study guide. Otherwise, you can just listen. Okay. Everybody have it pulled up? Yes?
Yeah.
All right. So 7, 8, and 9. Okay, I've copied and pasted the weekly readings so you don't have to go back to your modules. Okay, if you want to go re-review a section, there's all your readings. Okay. Same exam, same kind of exam, 50 questions, multiple choice. Math problems, I've put at the end here, just so you know. Math problems. I just skipped to the back. No, I don't want to confuse you. All right, let's go back. Same kind of exam, general math questions to review, IB calculations, conversions. Calculate, let me be more specific with math questions. Calculate a single dose. This is at the back of your study guide. Calculate an IV dose over time. Calculate meals per hour. That's what you've had in your last exams. Okay. If anybody struggles with math, what's the resource that I've been sending you to? And who's watched it?
I've been watching the one for Bogart.
Yep.
And
Is it good?
she's good. I think I understand the math a lot more with her concept
Okay.
because it's only that's one simple one that she's
Mhm.
using. And
Right. So in week 1, I sent you all an announcement that had a math resource. It was Professor Bogart. She's a pediatric instructor. She does a very simple tutorial of basic math. She breaks it down super easy with the basic formulas. Okay. So I would suggest if you're struggling with math over the first 2 exams to go back and review that. I don't think you need to go to your Calculating with Confidence book that you have in your resources. I really think you should start with Professor Bogart's tutorial. And there's handouts to it as well. Easy handouts to follow along. Sia, can you turn your camera on, please? Okay. Okay, so what are we covering? Week 7 concepts: infectious disease prevention and control, HIV, TB, sexually transmitted diseases, and then bioterrorism and disaster. Okay, that's week 7. Week 8 is home care, community resources, and case management. And then week 9 we just covered is human abuse and violence and cultural influences in nursing. Okay, so we've got several. I've gone back, I put this together. This came together through several resources. It came together from your notes, your last 3 weeks of notes, which is the extended version, kind of my lesson plan, teaching points are your notes. So much more extended, much more detailed. Okay. I have taken information from your readings. Okay. So I've really actually what I've done is started out with all the readings, put together my detailed notes for teaching the concepts, pulling out the most important things for you to understand the concept, in reviewing the concept overall, and then honed in the information on the specific concepts to what I feel is the most important information for you to know that you're going to be expected to know in the exam to understand that concept. So what I would do, and I've said this before, start with your concept guide, which is this. If you are struggling to understand a specific concept after you read the concept guide, go back to those weekly notes, find that topic in your weekly notes, read the more detailed version. And if you're still having trouble, go back into the book and reread that section. Make sense? So in reviewing this, infectious disease and prevention control, one of the things you need to know about is the epidemiological triangle. Can somebody explain to me what that is?
What's that? I'm sorry.
The epidemiological triangle.
Oh, the host, the agent, and environment.
Yep. And what is each? What is the agent?
It's the disease itself.
Disease itself, right? Bacterial, virus, chemical, and who is the host?
The person,
person who has the
you can be the
disease.
host.
Person that has it.
Right?
Mhm.
And what kinds of things do we look at with the host for depending on how sick they might get or not sick?
How strong their
Immune
immune
Their
system
immune
is,
system,
system.
what kind of nutrition that they eat, their
Yep.
their
hygiene.
history.
Yep.
The care of the
Comorbidities.
skin.
Yeah. Maybe their age, maybe their ethnicity. Right? What
Hygiene.
hygiene? Yeah. And then how does the environment? Why is that the third loop in this
Some
triangle?
Or
bacteria
drinking
present.
water.
If they have proper health care around their area, if they're more like what diseases are more susceptible to the area, what is more common.
Bacteria
Hmm? What if they live in climates that are really hot, really cold, really crowded?
Crowded
Live,
TB.
yep. Live in a community that has a high crime rate? How
Mhm.
does the environment so it's a common, obviously there can be many different makeups between the agent, the host, and the environment. I just simply need you to know there are three parts. And would you be able to identify what an agent is, what a host is, and what the environment is? Okay. What do we do with airborne diseases such as TB? How do we care for those?
And 95 pounds.
and
Negative
95.
pressure to roll.
Yep.
Droplet precaution.
Yep. Contact precautions. Yep. N95s, private room,
Negative
Limiting
pressure.
the amount
negative
of visitors.
pressure. Yep.
Mhm.
Hepatitis. We need to know about hepatitis. What do you're gonna, it's on your concept guide, but hepatitis, we know it's viral.
Mhm.
Please know the difference between hepatitis A, B, and C. I'll put in the information for you that you need to know. Okay, smallpox. What's the difference between, we've talked about this in class, so I'm gonna go over it again. Is smallpox contagious?
Yes.
Yes.
And
Mhm.
feet.
And the
And-
smallpox also attacks the palms and the soles of the feet. Chickenpox does not.
That's correct. That's what I want you to remember. What does it present with? High fever, head and body aches, sometimes vomiting.
Mhm.
Hey, what about HIV? Bloodborne.
Mhm.
How is it spread? Sexual contact, sharing of needles. Right? What about testing? Let's say somebody has a needle stick and they're getting tested.
You should
Do we want them
retest
to repeat?
check 3
after
months
3
later.
months.
Right. Why 3 months? Why is that the magic number?
Because when you first test, it probably won't show up.
Mm-hmm.
And false negatives.
Mm-hmm. Mm-hmm. What about why are we concerned about HIV in correctional facilities in particular, or crowded
Fragment.
facilities?
Because they're most susceptible to opportunistic
Yeah. Infections,
infection.
yeah.
Yeah.
Crowded living conditions, right? HIV already, so compromised immune system, right? So they're going to be more at risk for other infections, and an opportunist infection could be TB. All right, the last thing you need is a TB outbreak in a crowded facility, right?
Yes.
STDs is a few to know about. STDs, remember, can be bacterial or viral. They're bacterial, we can treat them. If they're viral, we can't, right? It's symptom management. So have a look at chlamydia and gonorrhea, they're bacterial, syphilis. What happens if you don't treat syphilis and you're working with a pregnant mother? What
Baby could
happens?
be blind.
A tertiary.
It could be big problems for the baby if the syphilis is not treated, right?
And once it gets to the tertiary stage, it can become incurable.
Totally. Yep, totally. And then there's a little bit of information in there about herpes and genital herpes. To take a look at week 8 concepts, home care, community resources, case management. What's home health? Two things I want you to remember, but there's a lot, but two biggest things is where's the care being provided and who is it being provided to?
Individualized care to the clients, and it's provided in the home of the client.
So I want you to remember that home care is individualized care. You're going into the client's home to take care of the individual. It's not group care, it's not population care, it's individualized care. Now, you may be working with families that live in the home that you want to work with to help so that they can help care for their loved one, right? But primarily your focus is on developing a plan with the individual. Okay? Obviously, one of the goals of home care is to work towards self-care, right? Work towards independence. All right, that may be a combination of the home care. Home care, it could be family, neighbors, caretakers, right? We're working towards independence and self-care. So it may be a combination of somebody helping with activities of daily living, somebody coming in doing medications, dressing changes. Lots of people may be involved in home care, right? We talked about the assessment phase being longer in the home care setting. Why? We're a guest, right? We're a guest in their home. We need time to develop a relationship with them. Does that make sense? We need time to do an assessment of the whole home situation, the physical layout, safety assessment, risk for falls, right? There's a bunch of furniture in the way. Is there a bunch of non-stick mats that everybody's slipping on? All right, so we have to do our environmental assessment, our safety assessment, our medical assessment, and just get a layout for their environment. Right? And in order for us to be doing all that, we need to have developed a relationship with, not a relationship, but you guys
And
know what
good
I'm talking
rapport.
about. Yeah, we're a guest. We're gonna be walking around every room in their home, opening doors, seeing where rugs are and whatever. Okay, so the point is that it's going to take longer to do a home assessment than it might take to do in the facility. Okay? Omaha system, we talked about that in class. Remember, the Omaha is a documentation system that was implemented by the Visiting Nurses Association to keep documentation organized. Okay, so you would be able to organize it, sort it, and be able to pull out information as you need it for all the providers that might be involved. Because think about home health, right? I have a little grandson who is 15 months now, and unfortunately, Patrick had a perinatal stroke during delivery. And so Patrick requires a lot of services. Okay, so home health is very involved in his care, but he also has PT, he has OT, he has speech, he has early intervention services. He just has a lot of services, but it's all organized through case management and home health. Okay, so that's what the Omaha system is. Okay, it's the ability for all the workers, all whoever's involved in the services, they can look into Patrick's chart and see what's being done in every discipline. Make sense? Medicare. Medicare is a big part of home care. Got to know about Medicare. Okay. Medicare is typically, well, Medicare, we can talk about case management too, but Medicare is typically reserved. So Patrick just went on Medicare, ironically, about 2 months ago, my grandson. Because remember, Medicare, we think about Medicare for the old people, right? But Medicare is not only for 65 and older, but it's for
So cute.
disabilities of any age. All right, so Patrick is now on Medicare, and there's lots of rules as far as what they cover for home care, what has to be done inpatient versus consulting. So it takes a lot of collaboration. His case is a lot of collaboration. Okay, and that's what home care is. All right, so let's jump into case management, keeping Patrick as our patient. Okay, Patrick is a case manager. That case manager organizes everything from all the appointments to early intervention services, all the way through surgeries, all the way through keeping in touch with doctors, making appointments, because he's considered chronic complex or complex chronic illness with his seizures. Okay, so let's talk about case management for a minute, right? So every client does not need to be case managed. Okay, case management is for complex, chronic, expensive cost clients, right? Because so many of the services are kind of overlapping. And we want to make sure the services aren't overlapping and we're overusing them. And there's a lot of rules around case management with regards to Medicare. Okay. And think about all the knowledge and experience case managers need, right? Knowledge, skills, knowledge of community resources, financing methods. This case manager works with the insurance companies about what's covered, what's not, what part of the surgery is, what kind of surgery can he have? He actually just had a hemispherectomy in March, and traveled to Chicago to have that done. That took a lot of organization with the case manager. Okay. And we talked about this in class. I want you to be aware under case management, it's the third paragraph, of the different ways case managers may communicate. Okay. And we have the 3 C's: collaborating, cooperation, and compromising. There is a difference. So have a look at that paragraph. And then the 4th one is assertiveness. What are we doing when we collaborate? What are we doing when we cooperate? What are we doing when we compromise? And what are we doing when we need to be assertive? Okay, because you're going to get asked about that, given a scenario, and say, what would be the best communication technique to use here? Okay. And then the last section is what we just went over, so I'm not going to go over that. Week 9, human abuse and violence, cultural influences. So, okay. So that's how to attack your study guide. Remember, as we talked about before, remember to be mindful of positively worded questions, or positive STEM questions and negative STEM questions. Somebody give me an example of a negative STEM question.
A mother and 2 children come into the ER, and you're kind of suspecting the mother seems withdrawn, and as well as the children, and one of the children are complaining of a stomach ache and a headache. What would probably be your suspicion? And it would probably be like abuse in the home somewhere. since the mother seems withdrawn, the children seem withdrawn. I think that would be kind of like a negative one.
I'm going to rephrase that for you to make it into a negative one.
Okay.
The parent comes into the ER with 2 children, and parent comes into the ER with 2 children, and parent comes into the ER with a kid with asthma. He gets his nebulizer and he's ready to go home. After you've done the teaching, what does the parent say that makes you think that she needs further education? Maybe the parent says something like, I'm only going to give the follow-up medication that's been ordered when he has an asthma attack, where the medication says take BID for 7 days. Does that make sense? You're looking for
Yeah.
something the
makes
mother says that she might not have heard that part. She's so
Yeah.
stressed out about being here that she didn't hear that part. I'm gonna have to review that part with her.
That makes sense.
Okay, somebody give me another example of a negative question.
Something that a client might say that's inaccurate. For example, feeling like their type 1 diabetes are curable, and the question would be, what is it that client is saying to make them
I'm
like
just thinking back. I'm thinking back of exam questions. What about an exam 2 when the hospice patient said, I really don't want any more treatments unless it's going to cure me? Remember that question?
Yeah, I
Yeah.
do. They were in
So-
denial.
Right? So, well, yeah. So we have to go back and re-educate that the palliative radiation is not for curing your cancer. It's to help with the bone metastases, the pain. Remember that? I think on exam 1, we had a question where you're reviewing dietary education. And what does the client say that they need more education? And remember, the correct answer was, oh, I'm on a keto diet and I'm just going to stay on it. It's no big deal. Wrong. Right? So you're identifying somebody, or here's a third example. You're working with a family to make it a non-smoking household. And you've done all your education. What does a parent say that you just kind of go, right? What maybe the parent says,
Sometimes I
E-cigarette.
don't feel like, yeah, sometimes I don't feel like going out, so I'll just smoke in the living room.
Yep. Yeah, or you know what? Don't worry about it. I start vaping. We're good. Right? So something that's incorrect, right? So please be mindful of negative STEM versus positive STEM questions. Okay? Please be mindful of important words or cues or phrases in every question. Okay? If you got to read the question slowly. Does a word jump out at you? Right? That is, oh, okay, what's the first? What's the initial? What's the best? What's the least? Those kind of words are going to lead you to the right answer. I can't tell you how many reviews I've done with students that those little words are missed. Right? And we've gone through this in the quizzes. One of the keys to that is if you come upon a question, right, that there's more than one right answer in your mind, but it's not a select all that apply. You miss something. So go back and reread it. Use your highlighter. I've heard more students talking about highlighters and the line through this term than I've heard in previous terms. So students are using the highlighter to highlight a word or a phrase or a cue. Remember, All the information you need to select the answer is in the question. Don't be ad-libbing all your stuff into that. Okay? You only need the information in the question. That's it. You're not expected to know what happened before or after. Deal with the present. The present is the question. I can't stress that enough. When I ask students, so why did you pick that answer? They start with, well, they'll start telling me, I'll say, whoa, hang on a minute. Is that information in the question? Student will say no. Then why did you add it in there? Okay. I know these sound basic, you guys, but this is what I hear. All right. So be mindful of all the information you need to select the correct answers in the question. That's it. Take your time. All right. There's no need to rush through it. Please make sure you can do these simple math questions, right? Be able to calculate a single dose, calculate an IV dose over time. These are simple formulas. Okay, and then calculate a mils per hour. There's a formula for those. Okay? You guys will do fine on exam 3, and just shoot for the highest grade possible in this exam, just to give yourself some breathing room as you go into HESI. I hate students going into HESI saying, well, I have to get this to do that. Just don't even think like that. In fact, don't even think about HESI. Let's focus on exam 3 next week. All right? And then HESI's on the heels of that. Okay? So, question, is it helpful to go through a little bit of the study guide, the concept guide?
Yes, it was helpful.
Okay. Okay. That's all I have for today. So this is kind of technically our like last class. Next week is exam week, and then reviews we have. So I hope this class was beneficial to you. I hope it was to give you an overview of what community nursing, public health nursing is all about. I hope you learned a lot. I do appreciate, I know this at the beginning seems like a tough class to get through, but hopefully it hasn't been that tough. If you've kept up and turned everything in, you're in good shape. You're in great shape. I'm here to support whatever anybody needs to get through exam 3 and get through HESI. If you find that after you do your due diligence in preparing for exam 3 or preparing for HESI, and there's concepts that you're just struggling with or want to talk about, please email me and set up a time, and we'll do some quick tutoring and go through whatever you're not understanding. Okay, I offer that to everybody. Okay, for both the final 2 things. Get your, there's some hard dates here too. Hard dates, you got to remember, I put it in the last announcement. September 25th. September 24th is a Sunday. Okay, everything's due by then. Okay, everything. All your week 11 work, so that would be your, I guess remediation you can do up till Monday, the 25th, but it's not worth it wait till Monday to do your remediation, especially if something goes wrong. If something goes wrong with your remediation and you're on Monday, if it's not turned in by Monday night at midnight, you get a 0 for your HESI. So that's why I always say Sunday. So after Sunday, December 24th, nothing else can be turned in. All right, so obviously your HESI needs to be taken, and that last NCLEX assignment in week 11, there's no 7-day grace period. It has to be in by the 24th. And no late work, and these are just hard dates. Okay, and then get your remediation done by Sunday, September 24th. In fact, I would just highly suggest that as soon as you're finished your HESI, try and get that remediation done ASAP. So that's my input and suggestions from past issues on past terms. And don't email me and say, what do I need on my HESI to pass this class? Because I'm just going to respond with 1200. Okay, that's my goal. Everybody gets a 1200. Okay, that's what I want you to shoot for. I'm not going to give you, oh, you need a 768 to pass. No, I'm not going to do it. All right, because I don't want, that's too easy. Okay. Okay. Questions? When the evaluations come up for this class, student evaluations, I love to get feedback. So if you would, I'll send an email reminding you, but if you would try and complete your course evaluation, I'd like to get feedback. I can plan on improving my teaching styles, my techniques, my mannerisms, whatever. But I take my evaluations very seriously. So I appreciate your both positive and constructive feedback as well. Okay, it helps me do better. All righty. All right, that's it for, I'm going to stop the recording.